Assalamu alaikum. Hello and welcome to another episode of Care Across Cultures. With me, your host, Mirban Hussain. You're listening to us on Link FM 96.7. We're available on DAB and online. This show is about making care feel human, personal, most importantly connected to people's lives and cultures. Rotherham, as we know, is a diverse and rich community. But hospice care can still feel unfamiliar, distant, and not for everyone. There are gaps, sometimes in understanding, sometimes in trust, and sometimes in making connections. Care Across Cultures is about closing those gaps by listening to real stories from real people, learning from communities, doing things differently. Today's focus is about community. It's about connection. It's about something that is so important for a charity, all charities, and it's something that's so important for Rotherham Hospice. It's about how fundraising brings people together. As always, this is your programme too. If you have a question or want to join us, you can call us on 0114 26181, or you might want to text us on WhatsApp 07939 849 339. I've got a wonderful guest with me today. We've been working together for a couple of years now, and we have a love-hate relationship, and I'll talk about that a little bit later. Yeah, I think it started off with hate, but now it's turned to love, because what do they say? You know, love and hate are the, two sides of the same coin. But it's not as bad as you might think it sounds. Before we start, here's a disclaimer. The views and opinions expressed on this programme belong to me and my guests, and are not necessarily those of Link FM or of the organisation that we represent. My guest today is Paula. Hello, Paula. How are you this morning?
I'm very well. Thank you for inviting me, Mirban.
Thank you so much for joining us today.
I've managed to escape you for several years, though.
You have. You have. I think just to clarify before we go anywhere else is that this love-hate relationship that we've got, I think that's really important to start off with.
Absolutely.
Do you want to tell us about this love-hate relationship?
Of course, yes. So our love-hate relationship stems from my holidays. Because I go on lots of wonderful holidays, and Mirban hates me because of it. But he doesn't really.
No. I started off with that because it was like every month, I'm going on holiday, and not just any holiday.
No.
No, these are super duper holidays all across the world, and countries that I didn't even know existed, or that I'd only ever heard about, but that's another story. So Paula, welcome to the show.
Thank you.
Tell our listeners a little bit about who you are, what do you do in terms of your job role at Rotherham Hospice?
Okay. So my job is the Fundraising Events Manager at Rotherham Hospice. I class my role as bringing people together to support the hospice in lots and lots of different ways that's both meaningful and enjoyable for everybody. Me from the perspective of getting to organise the events, and looking at lots of different events that we can organise, and hopefully from the participants' perspective, from them taking part in the events. We have a whole calendar full of events throughout the year. And we're just starting. So the first part of the year tends to be just one or two little things because of weather and so on and so forth. But then come June, right through to December, it's absolute total chaos and mayhem. But it's fantastic. We love it. We have an absolutely outstanding team. We have a super manager that really welds us all together. I work very closely with my other colleagues in the team. And we do definitely put the fun into fundraising.
You definitely do. You definitely. I'm right in thinking that you are the largest team after the clinical and medical teams.
Yep.
Yes, you are the largest team, and
yep.
You're all absolutely wonderful. Everybody's absolutely wonderful. So fundraising. Why are you fundraising?
We are fundraising to keep the hospice running. We have within our team, I organise the events. We've got a community fundraising team, a corporate fundraiser, trusts and grants, and individual giving. And between us collectively, we need to raise an awful lot of money, and a retail team as well. Don't forget the amazing retail team we have in the cafes that have just recently started operating. So between us, we have to raise an awful lot of money to help the hospice.
Roughly around 6 million a year, isn't
Absolutely,
it?
yeah.
And this is something that our listeners may not appreciate or understand. That Rotherham Hospice, all hospices are charities.
Yeah. Well,
there may be a few that aren't.
Yeah.
I know the one in Doncaster isn't.
No.
That's the NHS, isn't it?
Yeah.
But majority of hospices are charities.
Yep.
And as charities, hospices get some money from the government.
Yeah.
Roughly about 37%, something like
Round
that.
about, yeah.
And the rest of the money we have to fundraise for.
We do, yeah.
We have to find money for. And the key thing is that all of the services that we provide at a hospice are free of charge.
100%, yeah.
And we could not deliver any of the wonderful work that all hospices do across the country without the support of all our wonderful people who donate money, their time, and lots of other things as well, isn't it? So it's a key part of any hospice.
It is, absolutely, and quite rightly. Without our supporters giving their time and their money and their taking part in the events, we wouldn't be able to deliver the services that we need to Rotherham and support the community. Yeah.
No, thank you. So I'm going to ask you, before we get into all the great good stuff, a day in the life of what do you do day to day?
Okay, cool, blimey. I get up in the morning, have a bath and come to work. So the day-to-day might involve planning events, like our midnight walk that's coming up next 4 weeks on Saturday, believe it or not. 3 years ago we introduced a ball into our calendar of events, so there's that happens every year, and it's our 30th anniversary this year, so I wanted to introduce an overseas challenge. So in November this year we have 18 people trotting off to China to walk the Great Wall of China, which is amazing.
And you're going as well, aren't you?
I'm not.
Are you not?
No, no, I'm not. I've got another event on the day that they're due home, so various reasons, no. But next year we're doing Kilimanjaro, and I am doing that.
You're doing. Oh, okay.
So we'll start the training eventually. Yeah, yes. We've got 16 months, I think now.
Plenty of time. You don't need that. Tell me a little bit more about Midnight Walk, because it's coming up very soon, isn't it?
It is, yeah. So Midnight Walk started in 2008. Which was when I started at the hospice. So I have been in attendance at every single midnight walk we've ever done.
Wow.
The very first one was the last, well, at the time, officially the last ever event that took place at Millmore. And it was the brainchild of John Breckin and the people that worked at the
And
hospice.
John
at the
Breckin
time.
is one of our ambassadors,
He
isn't
certainly is, yeah, and a former Rotherham United player and
Wow, yeah.
assistant coach. So John is still very much involved in the midnight walk. We had a few years because of COVID where it didn't happen, and it's had a few different looks over the years. We changed it to 10 o'clock start in an evening, but really midnight it's just got a bit of a feel for it, a thing for it, and kids get really excited because they can take part, and they're staying up late and getting dressed up in the t-shirts and glitter and sparkly bunny ears and tutus and everything, men included. Everybody dresses up, everybody, it's just amazing. It's
So how long is it, the walk, actual walk?
It's 10k.
10k.
So yeah, so we anticipate
10K. That's about 7 miles, isn't
it's
it?
6 miles.
6
yeah.
miles, yeah.
So the quickest walkers will come in probably within an hour and a half. The slowest ones, which would be me if I was doing it, about 3.5 hours. But it's a walk around Rotherham. We have cheer stations along the way with refreshments. We have obviously toilets and lots of people just cheering everybody on. It's just a really, really fun-filled night.
So people who may be listening, can they still join and be
Absolutely,
a part of it?
100%, yeah.
So how should they join?
So
What's the
go
best
to
way
our website, www.rotherhamhospice.org.uk, and look up the event is on the front page. You can actually turn up on the night and register, but we would encourage people to register beforehand, because you get a t-shirt, you get your bunny ears.
Right.
There'll be other stuff for sale on the night. There'll be glow merch for sale on the night, and there's Rotherham Radio are there. We've got Blue Crew coming to sing live.
Maybe we should have Link FM there as well.
Maybe we should.
Maybe we should.
We should. Yes. Yes.
Maybe.
We will.
Let me have a chat with Link FM.
Okay.
Let's see if we could get that covered from that angle as well.
Yeah.
So, a little bit about you, again. What got you interested in fundraising and events?
Yeah, so this is really not a very exciting story, let me tell you. I had been living in Portugal. My husband is Portuguese. We've been living in Portugal. And God, I love my husband to pieces, but I think he's the only Portuguese person on the planet that doesn't like the sun, and whinged and moaned every day that we lived there because it was too hot. So I gave in, I relented, and after 5 years we moved back to the UK, and I needed a job. I fell into this job literally on a temporary basis to start with, a couple of days a week. I knew somebody that worked here, even though I'm not originally from this area. And the rest, that was 18 years ago, and I've been here ever since. So I was temporary for about 4 or 5 months, and then I think some point in August this year will be my official 18th anniversary of being here. Wow. And I've done many jobs while I've been here. I originally started as admin. I've managed the lottery, moved over to events in 2022, just as we were coming over out of COVID. Right. So yeah, not a very exciting story. It was just I fell into it, but I can seriously say this is the best job I've ever had.
You're meant to be.
Absolutely, 100%.
I agree with you completely. This
100.
has to be probably the best job I've ever had.
Yeah.
Because it's not a job, is it?
No.
This is the great thing about it.
Yeah. It's Friday. I was out getting covered in coloured paint. We were at a colour run. It's crazy to think that's how I spent my Friday. Yeah. And just having fun with a load of school kids that were just having a blast as well. Yeah. So not only was it promoting community within the community, it was promoting health and exercise to children. So that was a great, fantastic experience for us to be involved in.
Because fundraising, apart from raising money, is not just about that, is it? You know,
No.
It's more about how we engage with the community.
Building relationships. Yes. Yeah, 100%.
And the other thing is that, we talk about cancer, and I talk about cancer a lot on this show. There are still lots of sort of misperceptions, misunderstandings, stigma, fear about cancer, isn't it?
Yes, definitely.
What's your take on how fundraising, sort of what helps to overcome that? Because with the events, they are fun events, aren't they?
They are fun events, and we do tend to attract people after they've been involved within the hospice, and it's their way of wanting to support us. We will still get people who are going through the process of their loved ones being cared for, but a lot of the time it's an after effect. I think for me, we talk to the families again after they've been involved within the hospice, and they talk about the stigma from their point of view of how difficult it was for them to think about coming in here, because everybody just assumes hospice means death.
Yes.
And that's not always the case. It is palliative care, and the long term, probably, this is the wrong word, but it's not a goal, is it? But long term, that is the outcome. But it could be many years down the line, and we're there to help pain management, symptom control, and just how to deal with things. We're there to support you. You might not know where to turn for help and support other than the hospice, and that's what we're there for. The majority, we're there to add the fun into it afterwards, but the rest, it's a whole holistic, encompassing package that we can support with, as well as beforehand and afterwards. It's not just.
And it's so right what you said, because when I first came to the hospice a few years ago, and I told lots of my friends and colleagues, I'm going to work at Rotherham Hospice, and they said to me, that's where people go to die, which was really heartbreaking for me. Because and I said, no, it's not the knacker's yard. People do not go to the hospice to die. Some people, unfortunately, do die in a hospice, but people go to hospice for the things that you mentioned. Pain management, symptom management, support. And as you rightly said, palliative care, which is about pain management, symptom control, all of those kinds of things, may last 10 years.
Absolutely.
20 years. So people don't go there to die.
Yeah.
It's a big thing, and we need to break that stigma.
We do. People always say, that must be such a sad place to work, and it's like, no, it's not.
It's not.
It's absolutely not. It's the best place. Sad things happen.
Yes.
Sometimes, a lot of the time, but it's definitely not a sad place to work.
And it's completely
incredible.
different, isn't it? I mean, I encourage people to visit your local hospice. If you're in Rotherham, come to Rotherham Hospice and have a look. You don't even have to have yourself or a family member who has cancer or a life-limiting illness. We are open to the public. Our cafes is open to the public.
Come and have a cuppa and a slice of cake. It's amazing.
The cakes are wonderful. Yes, I think that's why I put on about 2 stone. The cakes are wonderful, and just come and experience the atmosphere. And this is true of all hospices that I've been to, and I'm sure it's true of all hospices across the country. They are not what you think they are.
No.
Ours is like a 5-star hotel. But I might be biased. It might be 4.5. But I think it's 5-star. Okay. So, if you just tuned in, you are listening to Care Across Cultures with me, your host, Mirban Hussain. I'm talking to my wonderful colleague, Paula, who is the Fundraising Events Manager. We've just been talking about how fundraising plays such an important part of hospices. Paula, how do culture and community shape how people get involved in... That's okay, that's fine,
So, I'm not going to lie, I have done a bit of homework and got some notes here to refer to, because my ageing brain will not hold all the information. So, I think culture and lived experience shape how people give and get involved. For some communities, fundraising is social. Yes. It's done through their family, their faith groups, their community gatherings, and for others, it's a very individual thing. They've been involved with the hospice, so they see it. Right, I'm going to do that event. I'm going to raise some money because you looked after my dad. And it might be a one-off, it might be an ongoing thing for years and years to come, but that's a very individual thing. Understanding those differences helps me and the team to make more fundraising more inclusive and relevant.
Yes.
We can't create an event that everybody is going to get involved in. So, but we try to create events that some people will get involved in, and then another event that somebody else might get involved in. It's very difficult to do everything for everybody.
Of course it is.
But we try and work across the cultures, the different society that we live in nowadays, and try and have something that everybody can do at some point. If they can't do everything, they can do something.
I think that's the key thing, isn't
Yes.
it? Having something that everyone can sort of be a part of.
Yes.
Because one of the things that we've started recently is the colour run that you mentioned
Yeah.
earlier.
Yeah.
And the colour run is based on the Hindu festival of Holi.
Yeah, that's right.
Yeah. And what you did was that you took that festival and changed it into something else. Okay. And called it a colour run, which is fantastic. So the same kind of things happen at a colour run, you know, where they throw colours at each other.
Yeah.
And people enjoy it. I think we smashed all records.
Oh, it was
this colour run, didn't we?
so fun.
Yeah.
It really was. Yeah.
And everybody can get involved.
Yeah,
Everybody
absolutely.
can get involved.
Yeah.
And they do.
They do.
They do.
Yeah.
And
Yeah.
we're always working, aren't we? So here's a shout out to the audience out there. If you are from a particular community, or from a particular faith or no faith or whatever, if you've got an idea for an event that would, you know, support the hospice, get in touch with Paula. If you live in Rotherham, just turn up at Rotherham Hospice and ask for Paula, and she will be more than happy to see you and have a chat. She'll also even get you a slice of cake and a cup of tea or coffee and just come and talk. Because who knows?
Yeah.
I mean, all these ideas, all these events that we do, they started with one person saying, oh, I've got an idea.
Yeah.
And I know that out there are so many people with so many ideas. Get in touch and see what happens.
Definitely.
Your idea could become, you know, another midnight walk, another ball, another colour run. Could be any of those things.
Skydive, wing walk.
Yes, all of those kinds of things are
Absolutely.
great. All of those kinds are great. So, I think you've mentioned it already, but what helps people feel that an event is for them? Based on what you've already sort of...
Yeah, gosh, I don't know. I think it's a very individual thing. I think it depends on the time, the place, the event, their frame of mind at the time. Yeah. But most of all, I think it's we do find that if somebody's getting involved, we'll talk about the midnight walk. If somebody's getting involved with the midnight walk, then they might get their next door neighbour to get involved, or their work colleagues to get involved, or so it's about bringing groups and families and friends together to enjoy. It's about having that community spirit and really just being able to feel. I think people feel good about themselves for doing something good for a good cause. So it's about the good, passing the good on to each other.
Paying it forward.
Paying it forward, absolutely. Yeah. And I think that is a really important factor in not only in how the human brain works and everything, but in just helping. And it has a knock-on effect and in a good, positive way.
Right. We are coming to a break soon, but very quickly. A simple example where a small change helps someone take part from your experience.
Oh, flipping Nora. Now you've put me on the spot. So I think probably, and I'm going to keep harping on about the Midnight Walk because it's our longest standing event. Yes. It's our biggest event. But this is the fact that children can take part, the fact that they can bring their dogs along, because some people don't want to leave their dog at night, all night, because they're out, and just little things like that make it more accessible, and the kids want to do it because they feel like they're doing something, and it's also engaging them to be fundraisers from a really, really early age, and getting them to understand. So I think it's little things like that. It's not a big thing. It's all little tiny things.
It's those small things that people sometimes worry about.
Yeah.
And what you should do if you want to get involved in any of our events at Rotherham Hospice, or your own sort of hospice wherever you are, don't keep it bottled up. Just ask the question.
Yeah.
And Paula and someone like Paula will be able to. We're just going into a break and we'll be back shortly. Welcome back to Care Across Cultures with me, your host, Mirban Hussain. You're listening to us on Link FM 96.7. I've been having, it's more of a chat today because we've known each other for so long with my wonderful colleague Paula, who's the Fundraising Events Manager at Rotherham Hospice. We've been talking about everything about fundraising, what it is, what it's not. A bit of a journey from how Paula came into fundraising. And 18 years it's going to be in August this year that she's been. So that says a lot about her job, and she still smiles every day, which is amazing. So, Paula, I want to talk a little bit about community relationships.
Yeah.
Well, I've already mentioned that Rotherham, like many towns and cities, is very diverse.
Yeah.
How important are community relationships in your work? Because fundraising, the hospice is here for everyone.
Yep.
Okay. That's what we say and that's what we do.
100, yep.
And how does that sort of work in your particular area of work?
Ooh, blimey. Yeah. So, community relationships are really, really important, and delivering events. When we deliver an event, we deliver it to a community.
Yes. And
the community being everybody and anybody within the Rotherham, and quite often outside of Rotherham. If they want to come along, we do get people. We've had people travel from all over the UK for some of our events. The garden at Christmas, we had people coming from down south. We had people coming from up north. It was just incredible. Working with the community, that's what makes the event successful. It makes it meaningful, and we can sort of scale that and measure that on the success of the event. And the fact that our midnight walk keeps growing and growing and growing, we're doing something right. I'm not quite sure what it is, but we are doing something right.
I think it's you. Personally.
I think it's all of us. We're up till goodness knows what time in the morning, but we still keep smiling. We still have all these lovely, wonderful bunny ears lighting up the sky and everything. And when we do the ball, and we've got everybody there dressed in their finery and just there, and it's just everybody's there for the common cause. And that's what it is about, really, I think.
No, thank you.
Yeah.
I want to talk something a little more sort of serious. Fundraising is not just about the money, is it?
No.
Yeah.
No.
We've talked about the fun bit.
Yeah.
And you have to make it fun.
Yeah.
And money is important. What other impact do these events have? I want you to help people understand who are listening, our audience. What happens to that money?
Oh,
yeah.
So, the money that's raised comes directly back into the hospice. It feeds our patients. It bathes our patients. The nurses are there to care for the patients, the catering team, the housekeeping team, the fundraiser, everybody that works at the hospice and that volunteers at the hospice. Everything that we raise goes back into making the families, their patients, their support, their carers, their friends feel that they are part of something more than just being in a bed, being looked after. We don't, we make everybody, or try to make everybody, part of the family. And that's a really cliche thing to say, but it is what we are, and what we try and engage everybody in, to be part of a bigger family.
It may be a cliche, but it's true.
It is, yeah.
It's true.
Yeah.
I'm fond of telling this story, and I tell everybody the same story about personalised care, which is our sort of soul at a hospice, personalised care. And the story I'm fond of telling is that the gentleman who was end of life, and he wanted to see his horse. You remember that one? Yeah. And he was too ill to go for us to take him, so we brought the horse to Rotherham Hospice in our gardens.
Yeah.
And we took him. He, I think he just said goodbye to his horse. He passed away a few days later, my understanding. But these are the kinds of things that the money that we raise from fundraising events, these are the kinds of things that
we had a wedding yesterday, didn't we? We had a wedding. That's an incredible. We do have wedding, not every week or every month, but we do have wedding.
And this is one of those things I think that many people, many listeners or our audience may not understand. You can actually get married in a hospice. Yeah. Birthday parties.
But we bring Christmas forward if we need to.
Christmas forward if we need to.
Yeah.
We will celebrate whatever event that's important to you, that has meaning.
Yes.
Yeah.
Definitely.
We will do that for you, because when we talk palliative care, and we talk about how do we make your stay at the hospice as comfortable, as meaningful, for you and your family, we're building memories, aren't we?
We are, and I think people think it's just all about the medicine, and it's obviously a huge part of it.
Yes,
but it's everything over and above that. That, like you say, it's more personal. It's how we can make you more your how we can make your memories memorable, how we can give your families and friends and carers and supporters something more than just the medicine.
A sense of belonging.
Yeah.
Isn't it?
Yeah.
To feel part of it.
Yeah.
And that's what, and fundraising is a very important part of hospice, but it's one part.
Absolutely.
It's one part, because there are so many other bits of the hospice that I'll be an hour just talking about all of the services that we provide. And not just us at Rotherham Hospice, but hospices across the country. Yeah. And one of the key messages I really want to, and I was hoping that you'd help me get across, was that do not be afraid of coming to a hospice. It's going to change your world. We may not be able to cure whatever illness you have, we not be able to treat it, but we will give you the best care that you could possibly think of. And I say that from my heart, because I've seen it.
Yes.
You've seen it longer than I have.
Yeah.
And that's not just one hospice, that's every hospice across the country.
Yeah.
Don't be scared of it. We need to, what happens is that we will all die one day. We know that.
Yeah.
But, and I've had a conversation with my, a lot of my colleagues who are medical and nursing staff, and they say that at the end of the day, man, it's an educated guess. When we say to a patient that, you've got 3 weeks or 3 days, based on all of the evidence that we can see on the tests and stuff, the liver's packing in, the lungs are going, it's an educated guess, because we all know of those people who were given a month to live and 20 years later they're still around. Yeah. So it's not just because you've had a diagnosis does not mean that that's the end.
No.
there are places like hospices. I love Rotherham Hospice, yeah.
So do I.
But I also love Wakefield Hospice, because I have a lot of love for them and Bluebell Wood with his children's and various others. Because the key thing about hospices that I've found since I've been working is that we are all here for you as the patient and your family members, and we will do whatever we can to make your life as comfortable, as meaningful as possible. Okay, so what I'm thinking about now is that you have all these events, and you've been here nearly 18 years now. Do events help people start conversations about hospice care from your experience? Anything that sort of springs to mind?
Oh, blimey. Probably. I think possibly more so in the more intimate events, because people are, it's difficult. It's I think they do. I think they do. When we'll go, So if you've got a smaller event, like we'll say we had a wing walk a few years back, and we only had about 4 or 5 people do that, but they were there for the same reason. But there was one group of 4 people that were doing it together. Well, they weren't all on the plane together. Obviously, they all went to individually, but they were all there for the common purpose, and then their supporters came, and I was just talking to people on the day, and the family members and friends knew what a hospice was, but didn't necessarily, and knew that their friend or colleague or family member, probably more the friends and colleagues really, rather than the family member would have more of an idea, weren't necessarily sure. So you can sort of like talk to them and explain that it's not all about dying, and get them engaged that way, and through that we have obviously built more relationships and encourage those people to support us, and hopefully feel less afraid of coming into what previously would have been an unknown environment. I think that's the thing, isn't it? It's about, I talk about cancer quite a lot. One of the things that really strikes me is that 30 years ago we wouldn't even use the word cancer, would we? No, it was the C word.
It was the C word.
Yeah.
And I find that many sort of communities across Rotherham, and I'm sure across the parts of the country as well, still are stigmatised by cancer, aren't they?
I would agree.
They still, and this is not necessarily ethnic minority communities. No. This is,
I think it's a lot of the older generation
the
as
older
well.
generation as well.
Yeah,
there's socioeconomic and geographical stuff that people don't, and this is what we want to change, don't we? And this is the whole reason. I mean, fundraising is part of that. This is why you do so many different types of events.
Yeah. I think there's also the misconception that everybody at the hospice is a volunteer. We're not all volunteers.
No, we're not.
We do have pay. If you cannot manage what we do just on volunteers, we desperately need volunteers, and our volunteers are incredible and give us a lot of money, but you have to have paid staff. My mum, when I first started working, I told her I was going to work at the hospice. She went, "How are you going to manage? You're not going to get paid." I went, "Yeah, I am." No, people like, "Oh, no, nobody gets paid at a hospice." I went, "Of course they do." Yeah.
And the key thing about that is that because you do need
you've got to have that, absolutely,
qualified staff, because yes, we're talking about all the fun bits, but a fundraiser can't just be any volunteer. I'm not saying that there are going to be people out there who are amazing. No. Who can come and do my job, your job. Better than we do. Yeah, I had a meeting with I had to have a meeting with the council and the emergency services last week for the midnight walk, and it's like nearly a 40-odd page plan that I have to put through to the council, because the walk is taking place on
public property,
Yes.
on council property, you know, out in the open. We can't just pluck you know, go, oh, we're going to have a midnight walk, let's crack on and do
just
it.
do it, yeah.
We've got to have the emergency that you know, I get questioned to the IT on this report, and then come back with a whole load of you know, adjustments that I've got to make because I might not have something quite right. So you can't, you've got to have that
the rules and regulations, the protocols,
that knowledge, that
the
experience,
legislation,
yes,
all of that.
Yeah, it's not just
we can't.
you know,
Like you said, you know, we can't just go out and have a walk. Not for the hundreds of people that come. Oh, is it thousands now?
We had 1,000 last year.
We had 1,000
so,
last year. We're going for a lot more this year.
We definitely are.
I just wanted you to, you know, tell us a little bit more about some of the other sort of immediate sort of events that are coming up soon.
Yeah,
we've got the midnight walk.
We've got the midnight walk. We're having a summer fair in the garden. Can't remember the date of that, but that's coming up fairly soon. But keep an eye on socials for that. It will be out and about. We've got our 30th anniversary ball at Wentworth Woodhouse. That has sold out in less than a day. That was just incredible.
Oh my God, yes.
Yeah. And then we've got skydive coming up. We've got a trick-or-treat trail coming up at the on Halloween. We've also got the Christmas garden will be opening for 3 weeks this year.
We only had it 2 weeks.
We only had it 2 weeks last year, but it was such a roaring success. It was really quite emotional that first night because we were a little bit scared.
Yes. Because we'd not done it before.
We'd not done it before. No, it was Matt's brainchild, and what a brain he's got, and it was fantastic.
Just to let people know, Matt is our CEO, our chief officer.
Yeah. And literally on that first night, people were walking down into the garden, and one girl came up and gave me a massive hug and went, "It's amazing, you've done a fantastic job."
Amazing.
I was almost in tears. Yeah. Another guy was walking down, he literally just walking down, he's on the phone to his family going, "Get online, get tickets booked, this is incredible." Yeah. People were saying it was better than Yorkshire Wildlife, it was better than XY, and it was phenomenal, I can't tell you.
And the months of planning and building, because my office sort of backs out into the garden.
Yeah,
and
you must have had some right laughs.
I was watching, you know, our facilities
the inflatables
team
going off and everything.
So I have to do a shout out for Ed.
Yeah.
For Pete.
Yeah.
For Matt. For Mark.
Yeah.
You know, and everybody else that was part of this, because
Debbie and Ruth were in the garden.
It's not easy.
No, definitely not. People
building
were
some
amazing.
And because it's not just building it; it's about keeping it safe as well.
Yes,
isn't it?
Definitely.
There's regulations.
Yeah. We were chasing inflatables around on some nights. We had to put them down because of the wind. And it was like, oh my gosh, this is a catastrophe. And do you know what? It wasn't. It was just.
It wasn't
fantastic.
And all of that money that we raised, it all goes straight back into the hospice, and it does. It sort of. Supports everything else that we do.
It does, and it's not, like I say, it's not just while you're in the hospice, because there's the counselling services afterwards for the adults and the children, and we get a lot of those people that have been affected, that their families have passed away, then come back as volunteers. So it's a circle, a 360-degree circle, and it just keeps going round and round, which is amazing.
And the other thing that I found is that, you know, as you rightly mentioned earlier, that once you've come to the hospice, either as a patient or as a family member, you never leave, do you? Because, you know, we have. I was talking to Gracie, our volunteer manager, the other day, and got 400 volunteers now. Which is absolutely amazing. And they all do something, don't they?
Yeah.
And then we've got, patients. We talked about patients, inpatient in the hospital. We have a 14-bed inpatient unit, but our hospice at home team, for those people that don't want to come into a hospice, we've got 300 patients on their books, haven't they?
Yeah.
And then they've got, I think, another 300 with an open door, where we don't see them on a regular basis, but they can access service. So if you think about it, that's like 600 patients that we support as Rotherham Hospice. Yeah. Because the reason I want to say that is because people may think, well, you only got a 14-bed inpatient unit, but we've got another 600 patients and not to forget the families.
Not to forget the families,
because we support the families as well.
We've got I've got 4 or 5 person counselling team.
We have, yes.
And then the Sunbeams.
Yes.
As on top of that. So and while patients are in, we've got a hairdresser, we've got a
bathing
therapies
service,
and
clinical therapy.
Absolutely, and
people don't, you know.
No. If they want to come in and have a
know.
hand massage or
This is it, those little things.
It's just things like that. It's
so we've really tried to think of everything, haven't we?
Yes.
How can we best support your journey?
Yeah.
With us at the hospice. Thank you so much. If you've just joined us, you are listening to Care Across Cultures with me, your host, Mehban Hussain. I've been talking to Paula, who is the Fundraising Events Manager at Rotherham Hospice. We are coming to the end of the programme now. So, I want to ask you, what would you say to someone who said fundraising is not for people like me? That's the first question. And then the second part of the question is that what's one thing you would like to leave with our audiences today?
So firstly, I would say fundraising, for those that say fundraising is not for me, I'll go, rubbish. Fundraising's for everybody. Because it's in a million different forms. There's no one way to fundraise. We have an example of a lady that for years and years and years, and I do believe she still does it, she has one of our little collecting boxes, and she sticks it on a windowsill at home. And anybody that comes round to the house, if she makes them a cup of tea, she tells them to stick 20 pence in the tub. And that's her fundraising, and that's fun. And she might bring it in once a year, whatever, doesn't matter. That's what she does. We've got the butterfly appeal coming up. Get a butterfly that is fundraising. Buying a butterfly to in memory of a loved one. Light up a life at Christmas. Buying a star in memory of a loved one. Taking part in a sponsored event. Volunteering is fundraising because you're saving us money. So there is something for absolutely everybody. And if there's one thing I'd like to leave everybody with today, well, there's two things really. It's the first one is sign up to Midnight Walk. It's amazing. It's the best night out in Rotherham. And there's no booze involved, so everybody can take part in it. Bring your dog, bring your kids, bring yourself, get dressed up, glow in the dark. It's fantastic. And also the other thing is, be a fundraiser in any way or form that you want to be. There are no hard and fast rules. You might have an idea like Mehban says, then please come and get in touch with us and talk about it. That's it really. Just get involved in your local community and support your local hospices, because without the generosity of everybody that is involved, we don't exist. Simple as.
There we go. Yeah. I want to leave it at that, because that was the best message that we can give. Thank you for joining Care Across Cultures. You've been listening to Paula Figuera. Have I said that right?
You have, yes.
Fundraising Events Manager at Rotherham Hospice. An absolutely wonderful lady. Personally, she's my colleague, and we get on famously, but for the wonderful work that she does, it's absolutely amazing. And a shout out to all the other fundraising events managers across the country who work in hospices. We thank you, all of you. We'll be back next week with another programme. Oh no, we won't be. It's Eid next week, so there will be no programme next week. We'll be back on the 2nd of June. Allah Hafiz, take care. This is Mehban Hussain signing off.